Welcome to Theory of Pets. I'm a passionate pet owner with a drive to help others like me uncover the truth about the pet industry and what goes on behind the scenes. I was introduced to Lori Cesario a couple of weeks ago, and I really wanted to have her on as a guest on my podcast. She's a board-certified veterinary oncologist, and if you have not dealt with canine cancer, you must know someone that has. It's become just as common in pets as it has in humans. Unfortunately, there are a number of reasons for that, which we'll discuss, but I wanted to have Lori on to just talk about, early cancer detection, what we should be looking for, some of the misconceptions about what causes cancer, as well as different cancer risk factors in dogs. And, it's really important for pet owners to know this. Like I said, if you haven't had to deal with it yet, you certainly know someone that has. So I really just wanted to have her on. I think it was a great opportunity to educate a lot of pet owners and people listening to the podcast. Even if you're not a pet owner, this is information that you can share with people in your life who might be dog owners and could be looking for some of these signs. Or if you know someone who has a dog suffering with cancer, Lori talks a little bit about treatment options and some of the things you can do to help a dog that is being treated to be more comfortable and have a better quality of life. So some really great information and tips in this interview. I will let you guys listen to it. But of course, if you have any questions, you can jump on our website, theoryofpets.com, or click the links below the podcast. That will take you to Lori's website. And there's really some amazing, fantastic resources on there about canine cancer and everything that goes along with that.
Hi, I'm Lori Cesario. I'm a board-certified veterinary oncologist, and I both practice oncology in the clinic like a traditional oncologist does, but I also have the Canine Cancer Academy, which is an online company that provides educational materials for pet owners that do have dogs with cancer, just so that they have a reliable resource that they can go to and get information that they can trust, basically.
Unfortunately, I have had pets with cancer in the past. I think if you've been a pet owner long enough and had enough animals, you've definitely had the experience. Unfortunately, it's very overwhelming to get that diagnosis. So it's great that you have resources out there, because I'm sure you got pet owners who just have so many questions and they really want to know as much as they can, and other pet parents, that have had maybe experience but still have some questions. Obviously, every type of cancer is different, and so it seems like no matter how many times you've dealt with it, there's always new information out there.
That's exactly right. Yeah, so you basically cover it all. So there's kind of the initial overwhelm and the questions about, should I be treating? If I do treat, what should I treat with? What does that even look like for my dog? What are the side effects? What's the benefit of treating? And, just very, very scary not knowing what the upcoming weeks and months look like.
Absolutely.
Yeah, go ahead. Sorry.
No, I was just going to say that's absolutely, I can definitely relate to that. And, with all the different types of cancer, I know it's impossible for you to be able to tell, kind of a broad, like, the what is coming in the next couple of months, because it will depend on the dog and the type of cancer and all of that stuff. But when you first go into your vet's office, obviously it's overwhelming, but are there some tips or questions that you really would encourage pet owners to try to keep in mind to discuss with their vet when they get that initial diagnosis?
Yeah, so there, I actually have a whole list of questions in like a question guide, but the big things are you want to make sure that you have a good understanding of what the diagnosis is, what the options are, and once you have all of that information, then you want to figure out like how aggressive you want to be with treatment. So Like if you're just starting off at your vet clinic and your veterinarian either suspects cancer or does give you a cancer diagnosis, then the next question, in order to really be able to figure out what your options are, would be, has the cancer spread anywhere, and what tests are needed to figure that out. And then the next set of questions are things like, how is this affecting him? Is he in pain? Is he feeling unwell? Because, there's one part maybe treating cancer, but then the big picture, just making sure quality of life is as good as possible. And another big piece of the puzzle, I think, is that it's always nice to just get a second opinion, because as a primary care veterinarian, they have such a difficult job to have to kind of keep up with every single specialty. So sometimes some new treatment might come out that they might not be aware of, just because it's not their job just to focus just on oncology. So if you think that you might be interested in cancer treatment for your dog, or even just you want to get as much information as possible, it might be nice just to schedule an oncology consultation, even if that just means sitting down with the oncologist for an hour and listening to all of your options. I have a lot of people that do that, because you really want to make sure that you're making your decision based on kind of solid evidence and not like a speculation about what might be going on with your dog. So in order to really figure out like what are the best options for an individual patient, typically we have to know like what is the actual diagnosis, and like is it just a little skin mass or has it spread somewhere else, and then is the patient otherwise healthy, and then of course how aggressive the family wants to be. If you tell your veterinarian, I want to do everything possible, then I think you're probably more likely to be referred to an oncologist, because they'll say to themselves, okay, well, they definitely want to hear all the options, I'll refer them, because it's hard sometimes, they offer things all day long, and, most people, regardless of the disease, whether it's cancer or whatever else, most people decline treatment and decline referral just for financial purposes. And so if they are just hearing no all day long, sometimes they just kind of stop offering referral. So if you communicate your desires from the very beginning, I think you're more likely to get the outcome that you want.
Okay, that's a great tip. And we've talked a little bit about the diagnosis and that part of it. But, we're seeing the cancer rates higher than they ever have been before. And I know that's something that a lot of pet owners sort of in the back of their mind always worry about, especially as their dogs age. Are there things that people can be looking for that are sort of early detection signs?
Yeah, that's a very good question. So I would say the biggest thing, and this is sort of early detection, but if you do notice a skin mass on your dog, I would say, just try and get it aspirated as soon as possible. So aspirate is just, sticking a little needle in the mass and getting a diagnosis, and we have the best chance of giving your dog the best outcome if that happens when the tumor is small. I think understandably a lot of people, wait until the tumor gets bigger, hoping maybe it won't get bigger or it'll go away. But, if the tumor gets larger, then it might get too large for surgery, or it might spread somewhere else, and then our options are really limited. So trying to get a diagnosis as soon as possible is definitely the best thing they can do. The other big piece of that is when you go to your veterinarian, you do honestly want to ask them to give you a diagnosis. There are many tumors that look benign, like they look like a benign fatty lipoma, However, they are not. Mast cell tumors, can look exactly like lipomas, so can other things. So you don't want them to tell you what they think it is, because they might say, well, it looks like a lipoma, and the fact is that it might be, but what if it's not? Then you're just monitoring a tumor that's cancerous and just kind of watching it grow, and that's just not the route that we want to take. So you always just want to ask them for the diagnosis, and then you can make the most educated decision about what to do. As far as other ways to get an early diagnosis, I would just say that cancer is just so difficult sometimes because it can present in almost any way. So that does make it a little bit challenging, and we kind of have to be detectives. So if your dog is a little bit older, middle-aged to older, and has a new behavior change or isn't feeling well, then sometimes we take our dogs to the vet and they give a treatment and it fixes it and all is good and it never comes back. But if the initial treatment that you try isn't effective, then just make sure that you don't wait too long. So give that treatment maybe a week to work or 2 weeks. But if your dog is getting worse or not getting better, then you're really going to have to investigate further. And, maybe that means, doing blood tests, or maybe that means doing an x-ray, or maybe that means doing an abdominal ultrasound. You do have to dig a little bit deeper to try and get the answer. And the other thing is that if the first person is having trouble getting a diagnosis or just can't figure out why your dog is feeling like he is, they just might not have the tests or the diagnostic tools necessary to make a diagnosis. So it's not wrong to get a second opinion and maybe go to a specialist and see if they can make a diagnosis. There is one early detection tool for bladder cancer. So some dogs with bladder cancer will have difficulty urinating, urinate frequently. It'll look like they have a urinary tract infection. It's called the BRAF test. And with just a urine sample, it's a pretty sensitive test to detect if there's a bladder tumor or not. So that's helpful. I was speaking to researcher Dr. Stephen Johnston a few weeks ago, and he said that his company has actually created a blood test that will detect diseases like hemangiosarcoma in the blood very, very early. So before you can find it, in the spleen on an abdominal ultrasound. So apparently that technology is out there. He's hoping that would actually come to market maybe by the end of the year or a little bit later. So something like that would really be a game changer. You can just use less than a drop of blood and find out at a very, very early stage if there's an aggressive cancer like hemangiosarcoma present. But at this time, we don't have that capability.
Wow, for sure, something to look for and follow. Mm-hmm. Absolutely. Mm-hmm. So are there certain products or things in the environment that pet parents can be aware of that have been known to cause cancer that they should be staying away from?
Yeah, that's a good question. So in general, it's always very hard to prove that one specific thing in the environment has led to cancer, just because, as our dogs go through life and they're exposed to so many things in the environment, in our homes. So it's always just really, really difficult to pinpoint if one exact thing leads to cancer, just because those studies typically involve thousands of dogs and a long period of time to pinpoint something. But what we have kind of surmised so far is that a couple of studies have shown that being overweight, so an overweight dog is more likely to get mammary cancer, more likely to get aggressive mammary cancer. more likely to get transitional cell carcinoma, which is a bladder tumor. Dogs that live in urban environments and dogs that live kind of with smokers are more likely to get lymphoma. The other thing is that Scottish Terriers, just from a genetic predisposition, are more likely to get that bladder tumor called transitional cell carcinoma. What's interesting is that if those dogs are exposed to lawns treated with herbicides, their risk of getting that cancer goes up by like 4 times. If they're exposed to lawns treated with herbicides and insecticides, their risk goes up 7 times. If their family's lawn isn't treated with herbicides, but the neighbor's is treated with herbicides, then you can still find evidence of herbicides in their urine. So that can still increase the risk of them getting the bladder tumor. The other thing in that study showed that Scottish Terriers, and they didn't look at any other breed or any other tumor in this study, but for those dogs that were fed vegetables, and they don't know the exact type of vegetable, but many of them were fed carrots at least three times a week, it did seem to reduce the risk of them getting that type of cancer by about 30%. So that was interesting. Dogs that are exposed to asbestos can also get mesothelioma like people can. So there are a few environmental factors that can increase the risk of dogs getting cancer. There's a huge study underway by the Morris Animal Foundation called the Golden Retriever Lifetime Study. And that's actually following 3,044 Golden Retrievers over their entire lifetime. So from the time that they're very young to the end of their life. And the goal of that study is to answer some of these questions. What genetic, environmental, and nutritional factors increase the risk for getting cancer and other diseases. So they're going so far as to get blood, toenail, and hair samples at regular intervals over the lifetime, and also having their owners fill out these exhaustive questionnaires about all of these environmental and dietary habits, like, does your dog eat vegetables? How often? How many times a week? How much? Okay, peppers? What color peppers? Does your dog swim in water? Is it a pond? Is it beach water? Is there carpet in the home? Is there hardwood floors? So just getting as much information as possible, because we do really need to know more about what increases the risk of various cancers for dogs. And since over 65% of Golden Retrievers do succumb to cancer at some point in their lifetime, they just decided that would be a very good breed to study. So hopefully that will give us more information.
Absolutely. And I'm sure there's more research being done all the time.
Oh, yeah. Definitely. We always just want more, of course.
Yeah. I mean, especially with something like cancer just has so many variables. It seems like you could probably do millions of studies and always be learning something new.
Exactly. And I think maybe a lot of people might not be aware that there are just such significant breed predispositions for cancer. So there is a genetic component for many cancers to some extent. Like if a certain breed walks in to an oncologist clinic, they sort of think of like, oh, well, that dog probably has this or that cancer, just because some breeds are just so strongly associated with certain types of cancers too. So that's just a very big part of it as well.
And I know there's this, myth, I guess, going around that I hear it all the time, that pure breed dogs are more likely to get cancer than mixed breeds. Is that something that you think there's some truth to?
So, certain pure breed dogs have, certain pure breed dogs, whether it's a Golden Retriever or a Boxer or a Bernese Mountain Dog or a Lab, there are certain breeds that we do see a lot of cancer in. But, if you mix two breeds, then you have to say, okay, well, what are the two breeds that are mixed to create this dog? Because if they're two breeds that have a high incidence of cancer, then we're still going to see a high incidence of cancer in that mixed breed dog. Or, if one of the breeds had a high incidence of heart disease or dental disease, that sort of thing, we're still going to see those traits pass to the mixed breed dog, even though it's mixed. The question is, okay, what's the dog mixed with? And that's going to help determine what diseases he gets. So I would say not necessarily a lower risk of cancer. It just depends on what breeds were mated to create the risk.
Right. That makes sense. And I'm sure we have some listeners who are dealing with this diagnosis right now. Do you have any tips or information for pet owners who have a dog who's been diagnosed with cancer on just caring for them and keeping them comfortable?
I would say that the biggest thing is that, if you are interested in treating your dog and you think there aren't options or there aren't any good options, then it's always nice to just see if an oncologist has any other ideas, because sometimes, there'll be something that an oncologist knows about that another doctor doesn't. So I think getting a second opinion is always a good idea. As far as quality of life goes, that is for sure our number one concern. So I would say the good thing is that most dogs with cancer, it don't feel painful from it. My pets or my patients are more likely to be painful from their arthritis than their cancer. When we're looking at the patient as a whole, we have to think about the big picture. So how is their quality of life affected by not just their cancer, but also their arthritis? Because quite often the arthritis is maybe affecting their quality of life more than their cancer, or just as much. So we can't just put blinders on. We have to just treat them as a whole, because there's so much that can be done to improve quality of life if a dog has arthritis. So if your dog is old, you have a cancer diagnosis, you're just very stressed about how they're feeling with cancer, talk to your veterinarian. Ask them, how do you feel their quality of life? Is there anything that can be done to improve it? If they feel like their quality of life is affected from arthritis, ask what can be done about that. Because I wouldn't just accept, him slowing down significantly, having so much trouble getting up. There are lots of things that can be done to improve quality of life. If your dog's cancer is causing a decreased appetite or drooling, that can be nausea. So nausea isn't just vomiting. There are all these earlier signs. So sometimes it's just incorporating an anti-nausea medication. The big thing is that we want to just kind of keep readjusting as we go. So if your dog isn't feeling well, just chat with your vet about what can be improved, make an adjustment, maybe wait a few days to see if it's working. And then if it's not, call your vet and say, look, we tried that. I'm just still not happy with how he looks. What else can we try? So you want to get them feeling better as soon as possible. So I wouldn't wait 2 weeks to see if it's working. I would just wait a few days. The other thing that's nice is that in some areas of the country, they actually have palliative or hospice care vets to your home. So for an older dog that's maybe sick or has cancer, and maybe you've just chosen palliative care, you haven't chosen to treat the cancer itself. If you have an option like that, then you don't have to take your dog all the way to the vet clinic and put him in the car. The vet can come to your house, and being able to see your dog in their normal environment is sometimes really nice too, because they're definitely going to be acting differently at home than they do in the vet clinic, and that can be really helpful to really figure out how they're feeling.
wonderful tips. Thank you so much for sharing. Is there anything else that we haven't touched on that you wanted to talk about today?
Let's see. I think that pretty much covered everything. I think the other just thing to mention is that I think a lot of people have a lot of guilt and conflict about, what is the best treatment or what is the right treatment. We have to remember that there's no one size fits all. Even if there's a best treatment for a certain type of cancer, you just have to pick whatever you feel is right for your dog and your family. The most important thing is just that we focus on quality of life and that we make sure that our dogs are not suffering, but don't feel guilty or get bent out of shape if you can't do the quote-unquote best option. We just need to focus on quality of life and how they're feeling, and the best option for one dog is not the best option for all dogs.
Absolutely. Thank you so much again for your time today. I really appreciate it.
Of course. Pleasure to be here. I'm happy that I was able to do this and that you asked me.
Yeah, it's a super important topic that I think it's important to educate pet owners about. And like we talked about in the beginning, it's something that's just so overwhelming and there's so much mixed information out there. It was really great to have you on. If you guys have any questions, feel free to send them along and I will get those answered for you, pass them on to Dr. Cesario if I don't have the answers for you. You can jump onto our website. It's topdogtips.com to send me an email, or you can go onto our contact page to send a message that way. And if you guys have any questions or other topics that you would like to hear discussed on the podcast, you can share those as well. If you guys have questions, chances are there's hundreds of other pet owners out there that are asking the same thing. So feel free to share. I will reach out to some experts in the industry and see if we can get some answers to help you and help educate other pet parents as well. One last favor, if you could take a minute just to give my podcast a review, that would be great, whether you stream it online or you listen on iTunes, however you listen, just leave me a quick review. That always helps to get new pet owners interested in the podcast, first of all, which is what it's all about, is educating people about the best care for their pets. And also it helps when I'm reaching out to experts in the industry. I can show them that you guys are out there listening and you want to hear more. So thanks a lot for tuning in, guys. I'll be back with another hot topic very soon.